Hello, and thank you everyone for joining us for our webinar today. My name is Jen Housel. I'm the Executive Director for the Association of Catholic Mental Health Ministers, and I'm so glad to welcome our presenters for today's webinar. We are grateful for all of your generosity in sharing your time and expertise with us today. I'll go through a little bit of a bio for each of the women joining us. Our moderator for today is Marjorie Arnold. She is one of our Association of Catholic Mental Health Ministers founding board members. Marjorie is a licensed psychologist in California, and she's passionate about all things humans can do for and with each other to bring healing and compassion to those of us with mental illness. Also joining us today from California is Linda G. Linda is the director of the Office for Family Life in the Diocese of Orange, California. And prior to taking on this role, Linda worked in Catholic donor services and in youth and young adult ministry. Linda and her family are members of St. Raphael Korean Catholic Center and are also active at St. Dominic Savio Parish in the Archdiocese of LA. Our next presenter, Rebecca Freeman, is a close colleague of Linda's. Rebecca is the Pastoral Care Ministry Coordinator for the Diocese of Orange. She is a board-certified chaplain, and her passions include healthcare ministry, early childhood education, expressive arts, and social justice areas affecting women and children. Our final presenter for today is Tracy Sherva. Tracy serves with the Chicago Archdiocese Commission on Mental Illness and is also active with the mental health ministry at her parish, St. James in Arlington Heights. Tracy is a member of NAMI, where, among other duties, she is a state trainer and family support facilitator. You can learn more about these amazing women on our association webinar resources webpage. Their more complete bios are all listed there, and we are so blessed to have these women working with all of us in mental health ministry. We're going to begin with an opening prayer. For those of you who have our St. Dymphna prayer card, please feel free to pray along. St. Dymphna's feast day was May 15th, so this seems a fitting prayer for us to begin today. And we start in the name of the Father, and the Son, and the Holy Spirit. Amen. Lord, we pray for those who have a mental illness. Help us understand that the way we talk about people with a mental illness affects the people themselves and how we treat the illness. So often, people who have a mental illness are known as their illness. People say that she is bipolar or he is schizophrenic. Help us not use those phrases. People who have cancer are not cancer. Those with heart disease are not heart disease. People with a mental illness are not the illness. They are beautiful creations of God. There is so much fear, ignorance, and hurtful attitudes that people who live with mental illness needlessly suffer further. Our society needs to provide resources to understand and treat mental illness. Help us support and be compassionate to those with mental illness every bit as much as we support those who suffer from any illness. Grant courage to those for whom we pray and fill them with hope. Help them remember you love them, they are never alone. Saint Dymphna, patron of those with a mental illness, pray for us. Amen.
Amen.
And with that, I'm going to turn the reins of today's presentation over to Marjorie.
Hello. Thank you, everybody, for coming today. I'm so excited to get to introduce you to these three women and the resources that they have gathered for their parishes, for their communities. So I'm going to just start with some questions, and then we'll have time for questions and answers at the end. And so I'm sure I won't think of everything. So if you have a question that you want to ask them, please put it in the chat, or not, in the Q&A portion, and we will definitely leave time at the end for those. So I wonder, I'm going to start with the question of what's the most requested resource that you have. And so Tracy's at it's kind of interesting because you guys are at all different levels, right? Like in terms of community, because Tracy, you're at your parish, and then I see you guys, your parish has connected to other parishes nearby. And then Rebecca and Linda, you guys are at the diocesan level, but then Tracy's at the state level for NAMI too. So all different sizes of communities. So what types of resources are most requested? And I'll start with, how about Tracy?
So from a parish mental health ministry perspective, I would say people are looking for Christian or Catholic therapists. That seems to be the top request we have there. From a NAMI perspective, it's slightly different, but from that perspective, that's what folks are looking for.
Yeah. Okay. Thanks. And well, since you do have that NAMI perspective, what kinds of things are people looking for there?
Oh, there's a whole host of
Yeah.
things.
Yeah,
You
I know
know,
I've called them with all kinds of questions, like legal advice, like how do you advocate for somebody? Yeah, there's so many things that they're such a great resource. Yeah.
yeah. Because I think folks are looking for support, education, housing, you name it. There's a wide variety of things.
Yeah.
And to me, all of those things are resources in some way or another.
Yeah, definitely. Yeah. Okay. And how about in Orange County? I will let Linda and Rebecca decide who wants to answer which questions, and or both chime in, however you guys want to do it.
Sure. So just in thinking through the last couple of months and different phone calls we've had, I think I find that there's a lot of families just trying to figure out where to begin. And so usually there's, I think Tracy, you kind of spoke to this, usually a couple of different situations going on. And the family member who's calling is just trying to figure out, okay, I think this is what's going on in my assessment with this member, but it's affecting this member in this way. And where do I even start? So I think that navigation piece is definitely something that's definitely sought after. I was just speaking to one of my colleagues in Hispanic ministries this morning. They just had a big event over the weekend, and we had given them a bunch of Spanish language resources from our suicide prevention, Dee Hirsch organization, and NAMI and others. And he was just sharing with me that all the suicide prevention cards and pamphlets had gotten taken, and people had a lot of questions in the Spanish speaking community about kind of what to do, what to look for. So it really created a good chance for dialogue and awareness, and also good understanding for myself and my colleague to think through how we can continue supporting this. So I think especially there's definitely a lot of ask around Spanish language and Vietnamese and other kind of languages and cultures around mental health and kind of what's available and in those languages and for those cultural groups. And then I would say also, I've gotten a number of calls kind of seeking support around like what should I do as a minister who works with youth, as a parent who works with youth, what's kind of out there and what should I have in my back pocket? And I know we'll talk about kind of the resource list later, but very grateful that we have an updated list that we can give people. I think just having that reassurance that and encouraging them to take mental health first aid most definitely as well. But just giving them kind of some structure to have on hand and have a list to keep in their car or in their, catechism book or, wherever kind of their place of ministry is. That seems to be helpful to kind of have a comprehensive list that people are looking for.
Okay, so my cat also sees me as a resource, and I was always, I'm her human support animal. So she might be jumping up. Hopefully my dog won't come in because he's loud. But Linda, do you have anything to add? Rebecca covered a lot, but how about you?
I I don't have anything specific to add, but I will echo, certainly from our perspective at the diocesan level, serving our clergy, I will say that list of Catholic or Christian therapists is highly sought after. So I think as they are assisting families in their parishes or encountering people in the confessional, those kind of spiritual, but also health, mental health issues kind of merge together. And I think that's where they really want to feel like they can help somebody directly and provide them with something concrete, and not just call this number, but here are some people who can help you. So for the clergy, I think they really like to have concrete resources, and that therapist list, especially of Catholic therapists, is very important to them.
Yeah, I know I started working part-time at the diocese right after Linda. And I remember you telling me, Linda, that that was the number one thing that the priest talked to you about, because you were going once a week. I don't know if you remember this, but you were going once a week to visit each priest, and they all would say that. And I know you worked really hard on coming up with some guidelines and a list. And I would like for, if you don't mind sharing a little bit about the guidelines that you have for our list, because I think from what I've seen, the orange list has a lot of structure.
Sure, I can share a little bit about that. I'm going to share my screen and I just realized we didn't try this out, but we'll see if it works. Let's see here. Can everybody see that PDF file?
And these will be shared later. Anything we show, we'll share.
Yes, we can share this PDF. So our list actually has two parts. The first part is the second part is the actual list of contact information of the therapists that we have vetted. Our list is composed primarily of marriage and family therapists. We also have quite a few licensed clinical social workers, and then maybe a handful of psychologists. But I would say it's primarily marriage and family therapists. So the second part of the list is the actual list. We provide their names, licensure, contact information, whether or not they provide virtual or telehealth, or their physical address, if that's how they see clients. And then we also specify, based on information that each therapist provides, what their areas of specialty are. And I think that's a really helpful piece of information. Rebecca mentioned how some people don't even know where to start. And so having that information in the list is helpful, because you don't want to send somebody who is dealing with, anxiety or grief to somebody who specializes in marriage and relationships. So although many of our therapists have multiple areas that they work with, we do try to specify some of their specialties as well as areas of passion. And then the first part of the list is what I call the guidelines. And this is just something to help our clergy as they're making the recommendations. Because we're not healthcare providers ourselves, we're not referring them in the same way that a primary care physician refers a specialist to one of their patients. So we just want to make sure that we're providing assistance, but not specifically endorsing any one therapist over the other. We're not mental health professionals ourselves. We're not diagnosing and passing someone along. So that kind of information is specified in the guidelines to remind our clergy that this is what we're doing. A lot of them are aware of this already, but just in case. So I include directions on how to verify licensure. I do check every time we update the list, which is twice a year. But in between times, we don't have the capacity to just monitor licensing at all times. So we do encourage parishioners to verify that on their own, and it's fairly easy to do so in the state of California. So we provide instructions on that. We also give a little bit of information about affordability. A lot of our therapists are private pay. Some of them might be on a few insurance panels, but it's kind of a moving target in terms of how they may or may not accept payment. So We do a little bit of an explanation on that. And then we've also listed some low cost providers in our county for those families who need help but may not be able to afford those who are on our list. I will say that at least, gosh, maybe 2/3 of the therapists on our list do provide sliding scales or reduced fees for certain circumstances. But if you're in a pinch or you just want to try to find someone as soon as possible, we do have a list of providers from all over the county. And then our county also happens to have a great resource called OC Links. So we like to put a plug in for them, which it's a great place to get started, especially if you're dealing with a lot of challenges at the same time, like Tracy had mentioned, homelessness or food insecurity, along with these mental health issues. That's a great place to start to get connected to a number of different services in our county, all provided at no cost to county residents. And then I explain at the end just what our vetting process is so that any of our clergy can feel assured that this is, who they're referring to has gone through a process with me here in the Office for Family Life. And the final detail is also very important to me as well. We believe our therapists are not just names on a list. Many of them are our own parishioners in the pews here in our Diocese of Orange. They are the faithful and they are professionals. So we believe it's really important to have a working relationship with them as well. So in addition to referring families in need to our therapists, we also collect them together for professional networking, for spiritual nourishment a couple times a year, so that they feel like they're a part of a serving community as well, not just names on a list. So I include that detail so our clergy are aware that we have this ongoing relationship with the clinicians that are on our list. So I'm happy to share this guidelines document. I've shared it with other dioceses as well. There might be better versions out there that they've adapted since I've sent it to them.
But I think that you lined it, you put it out there very clearly. And can you tell just a little bit more about how therapists get onto the list and about how much time it takes you, maybe say on an annual basis that you spend on this, if you could guess?
It depends. Normally about once a year, I'll put out kind of not a request, but I'll send out like bulletin announcements, or I'll send something out to clergy asking them, I'm recruiting for clinicians to be added to our list. So our parishes, if they have space, will put in our bulletin announcement kind of seeking mental health professionals. I can share a copy of what I've sent out in the past. I send it out in English and Spanish. We have a very large Spanish speaking population here in Orange County. So I'm always trying to find more who are Catholic. There aren't very many, but we do have a few. And so I send out a bulletin announcement. I send out a communication to clergy. Sometimes a priest will say, hey, I know someone in my parish who would be great, and they would recommend them. So I get connected that way. Or some people see our bulletin announcement, they're a parishioner, but they are also a mental health professional, and they'll respond. And I ask them for their licensing, insurance, a CV or resume, and a letter of good standing from their pastor. And so depending on how long it takes them to collect those things, some people send them in right away. Some people, it takes a little while. And then I do go through kind of an interview process. It's a interview where I meet with them and go over some of our questions. We go over kind of this agreement that we have with our mental health professionals, which I think you can still see on my screen because it's part of the guidelines. So we go through the points of the agreement to make sure that they understand what they're agreeing to as a part of the list, and just getting to know them as a person of faith. Sometimes a priest might reach out and ask because they have a particular situation or circumstance that they're accompanying a family with. And so not all of that can fit onto a list when we list areas of specialty. So then having met with them and having known these therapists, I can give them a little bit more insight into who might be a good fit. Again, we don't ever provide just a single name, but having that touch point where we meet is really helpful in making referrals for certain circumstances. So I would say I do it once a year. Sometimes I do it twice. I update the list twice a year, but that vetting process, between the coordination, I mean, it's an important part of the work because it is something that our priests rely on. So I make it a priority to make sure we take care of at least once a year. And then the list gets updated twice a year because I'm making sure all of the information is still current. A lot of therapists may switch, or recently they switched to providing virtual and teletherapy. So those are kind of details that have to be collected and put in. I would say it's not a lot of time, but it's something kind of to have on your mind throughout the year.
Yeah, great. Well, thank you for sharing that and for all the work you put into that. And I know people have made good use of it. And I looked, we tried to get also the Diocese of San Antonio to join us today, but they just couldn't join. It was hard for us all to be together, but I did look at their website and I know they put their list on their website through some links. And in Orange, how do you guys handle disseminating the list or making it available to people?
In Orange, ours is an internal list that is only shared with our priests, deacons, and our mental health ministry leaders. We also share it with some key diocesan staff. For example, our director of youth ministry, they have a copy of it, as well as Catholic schools, so that if they get inquiries, they can share the information from the list. So ours is not public, ours is internal only, at least as a list. So, and that's kind of the way that we've done it for liability, and it's what our risk management folks were comfortable with. And so that's how we do it. I do know other dioceses do it differently.
Yeah. Okay, great. All right. Well, let's go to another question. So if you were starting out fresh, don't have a list, or, how would you tackle this? Because this is what you've been able to spend time doing, Linda. It's a lot of time, and I know you have the support of the bishop for that. And that's very important to him. So not every diocese is going to have that same emphasis on mental health. So if you're just a person at a church and you know that people come to you and ask you these questions, how might you go about starting a resource list? Let's go with Tracy first, because Tracy, you are in a parish, and so how do you guys do that there?
Well, it was kind of interesting because we started our ministry right before COVID. And so when COVID hit, all of a sudden we couldn't have any meetings or anything. Mm-hmm. And one of our priests said, "Hey, I'm having trouble finding resources for people that are calling me. Can you help us? Maybe we need a resource page on the website." And we were like, "Yeah, great idea. We should do that." So I would say the way we started was to first really understand kind of our community and where the resources were that we could tap into. We had a team of folks with different backgrounds. So we had NAMI folks who could help. NAMI has a ton of resources. We had a nurse, a healthcare provider. We had a connection to, we have a community mental health center in our area. And so that was super helpful. But then at that point, we realized we had a lot of resources, and we needed to figure out, do we just put them all on there, or how do we use this big list? And then we started thinking about, well, what would people come to our parish website for? Like, what would they be looking for as a way to maybe focus what we were going to put there? Because Our NAMI, our local NAMI affiliate, they had a big webpage of resources. Our mental health center, they had a page of resources. So what was going to be different about ours? And so we needed to think about, well, what did we want? What did we want on our page, and what types of things did we think people would be coming there for, that they would seek their parish versus their physician or whatever.
Yeah.
And then we also needed to kind of figure out, well, a lot of us had been in the role of trying to find resources for our own situations. So having that insight into what your mindset is like when you're, at least this, I can only share my own perspective, you know, and it's in the middle of the night and I'm trying to research everything I can possible. I needed something that was easy to navigate, something that I could find things and click on or get to, because I wasn't talking to my friends about it. It's a very, in the very beginning of the process, stigma can kind of take over. So thinking about that as to how we were going to lay out our page. And then lastly, we really needed to think about, this is just us, about resources in a very broad sense. So one of the pieces that I'm a big champion of is education as a resource. So we wanted to make sure on our page that we included some educational information. So we took kind of the most prevalent mental health conditions, depression, anxiety, and then any type of mental health issue that's kind of coupled with an addiction or a substance use. And we put some educational information on there. So people could read and learn, and we took it from NAMI, that they could learn about those things and think, you know, I don't know, he's a little anxious, he drinks a little bit, should we get help? I don't know what's normal. So just having a little education kind of provided a little bit of resource as to whether or not, how to make a decision as to what your next steps could be.
Yeah.
If that's helpful. Those were a few of the things we looked into.
Thank you so much. I love each of your perspectives. It's so helpful. You're right. There is that middle of the night, like, who do I call? What, and that tunnel that people get into. So making it really clear is very, very helpful. And I do have your website pulled up. Do you, or I can even share it in the chat too, so people can pull it up. I think that, or maybe you want to share, Tracy, you might have something in particular that you want to share. I was going to put it, yeah.
You're gonna pull it up?
I can share it. Let's see. I can't talk and share and do technology at the same time, but I'll get there eventually. All right, let's do this. Okay, so this is for their parish in Arlington Heights, Illinois, and lately, I know Tracy earlier, one resource that you guys provide is just a weekly prayer time that Tracy described to me. It's like maybe a half an hour, Tracy, maybe 45 minutes, and there's some singing, some praise, some prayer, and some sharing. And that has been something that has really stuck, because you've tried different things in your parish. So I see that that's front and center, which is lovely, just to know there's a community there. There's a saint to pray to right there. And so this is some artwork that tells about you guys's groups.
Yeah, we're three parishes, the three parishes in our town.
Yeah. And then you have the emergency things right up front, like you said. And then you even have your also your names with your contact information, which I think goes a long way to I mean, just that you have this on your website, but also that there's a person's name associated with it, I think really helps to lower stigma. And then there's just different resources. There's support, there's education. You guys are scrolling along with me, right?
Yeah.
I don't know what you
Yeah.
see, so I just want to make sure. Okay.
So one of the things, when we thought about someone coming to us from a parish perspective is we wanted to make sure we had spiritual support things. So prayers, rosary, just information, scripture verses of comfort. Because we know, I don't know, to me, there's different prongs to a mental health journey, and the spirituality piece of it is so powerful. And I think sometimes, I actually think that's why our little prayer service is actually taken off the way it is, because people, sometimes that's all you can do. And having that prayer or that spiritual support in a time when everything is out of control in your life is so amazing and awesome that we have that. And so we wanted to lead right up front after the emergency stuff, of course, but we wanted to lead in with that, for folks to be able to tap into those.
Yeah. Right. And I think in your prayers gathering, you have people who are affected by mental health or mental illness in any way, right? So you have people who are themselves going through something, or people who are trying to help a family member or a friend, or so all together. Yes.
Correct.
Yeah.
Correct.
Okay. And I love all of these different resources, the spiritual links that you have there, some wonderful prayers, and just helps people to not feel alone, and to tap into that one thing that you can do, and maybe find some comfort and definitely support, whether you can feel it or not at the time.
Well, and the interesting thing with the prayer circle is we're praying for about 100 names right now. And we are getting feedback from folks that they feel a sense of prayer is being heard. And that is so wonderful to hear. And
Yeah.
some folks they're just thankful that they're not alone.
Yeah. Just you're giving me chills right now, because I'm thinking about the scriptures for today, and the whenever we do something, I'm gonna say it in my own Marjorie words, this is not the scripture words. Whenever we give from love, and we maybe are just giving from love, that it comes back to us many
Yeah.
times over. And
Yeah.
I always do feel that way about this ministry, for sure. Yeah. And I love that. I know from our conversation, you said that the deacon, when you asked the deacon, should you keep praying for these certain folks, he said, oh yes, because you're making a huge difference, which I just love that.
Yeah.
And I love that that's a way to also reach out to the whole parish, even if somebody's not experiencing that they hear, oh yeah, my church is a wonderful resource for this, and my church is a place where we can talk about this. So it's great. Well, I could just go on and on. So I will, let's see, let's see, we're about halfway through, and I know I have many questions, but why don't I give one to each of you, and then we'll kind of see what everybody else wants to say. And so let's see. Okay, so how about, and you can, I'll say the question out and you guys pick. You just speak up if it's for you. So you're gonna have to unmute your mics there, Linda and Rebecca. Okay, so one of the questions is, which agencies have turned out to be the most helpful in partnering with local resources? So even though people might have some similar resource in their community they hadn't thought of. How do you get the information to the priests, deacons, religious lay ministers, parishioners, and anything else that you think would be helpful? So anybody have an idea about which one they want to do? I haven't heard from Rebecca in a while, so I'm gonna toss it to her, because I know she has some good resources or has some good stuff to say. So which one would you like to do, Rebecca?
I will do the most helpful community resources.
Okay, great.
So on our list, I think Linda spoke to something that's, and actually what you just said about the scripture today too, Marjorie, that I think is so profound that it's really a blessing to be in relationship and partnership with our community partners, whether they're religiously affiliated or not. And so it's very special in Orange County that we have a lot of good networks around mental health, and a lot of folks who want to work with folks in the faith communities, recognizing that so often people experiencing a mental health crisis will come to a church or a parish first, oftentimes to seek that support and help. So they recognize kind of the mutual importance of our roles in this space. So we have a really close, good relationship with the county of public health, and our behavioral health training collaborative. We work with them very closely to provide those invaluable mental health first aid trainings, which the kind of demand and ask for that has seemed to be growing exponentially, kind of coming out of the pandemic, and folks wanting to kind of get trained and get more added to their toolbox. And then our national partners, like, Tracy, you're such an integral part of NAMI, but we work closely with them, and a lot of our parishes are actually able to offer family to family support groups. And we have more and more parishes wanting to offer that, and kind of seeing the importance of literally being on the grounds of a sacred space. And in terms of stigma, being able to offer a support group like that at the parish hall, at the church level is really important. We also have in Orange County something that might be somewhat unique, but maybe is being duplicated in other places, but it's something called the Be Well Network. So basically, some of our corporate partners kind of got together and recognized the need in Southern California around mental health, and recognized there were a lot of good people doing good things that maybe just weren't realizing all the good things they were doing together. And so created basically like a networking platform to get together on I think it's about quarterly basis, to kind of have panels and speakers, and to speak into the different things that are going on around mental health in the community. So I know personally, that's been a really helpful learning tool to also know just even some of the statistics and some of the pulse points of what's going on, but also knowing who the partners are and who we can continue, setting up individual meetings and collaborations with, and also just knowing on a broader scale, who's available as, calls are coming in, or as ministers are coming to us asking for kind of more specific areas of support and of education. We also are very blessed here to have our Catholic Charities partners feature their New Hope counseling crisis hotline. And they have a number of counselors and therapists who are very passionate about education. And so they've been able to partner with a lot of our parish mental health ministry leaders to provide programming and talks and other resources, and to go out and have panels and Q&As at the parish level in both English and Spanish. And so it's been a real blessing to have them to collaborate with, and again, go out and the parish level to provide some of that education as well. So again, just such a blessing to be part of a broader vision and kind of a broader movement, I think, around this, and really work closely together.
Yeah. Thank you. Okay, so there was another question. Oh, how do you get this information out to all the people who need it? And anything else? So Tracy and Linda, do you guys have anything else you want to add? Or a question to answer?
Well, we try to always include, like in any bulletin post or any newsletter or anything, we try and have our website there. And we kind of went through some bumpy challenges on the whole setting it up, because we needed to have a URL. It couldn't be a bunch of / long, so we needed to change our URL so it could be really easy for someone to remember. to make it so that it would be easy to share, and just have a link right to that, so you didn't have to dig around to find it. I also have found that printing out certain portions of it to give to certain people, that they have it. Like, we recently created like a resource crisis script for the folks answering the phone at the parish, just as another way to try and get those resources out there.
That's a great idea. I don't think we've tried that. Oh, we have one in other ways, but that's a really good way to do it, because
know.
yeah, we've struggled. I know I've struggled with that, because I think, well, where do you start? How do you, but just a script would be great. Yeah, okay. And Linda, any other thoughts?
Well, I just wanted to raise two things. One, in relation to your question, we try to talk about mental health whenever we can, but it's been very well received. I think, especially after COVID, there's a broad recognition that people are struggling with this, and families and youth and just a lot of people. So it hasn't been that hard. I think for us, we try to encourage and inspire and develop mental health ministries at our parishes so that they have a very local presence in our Catholic communities here. And then I believe this to be true. I think any priest knows in our diocese that if they need something around mental health ministry, they know who to call. And it took a little while for that to happen, but I'm pretty confident that they know now. So I think that's half the battle, just knowing who they can reach out to, then that this is an area that our bishop cares about, and that's an area of priority for the Office for Family Life, so they know to reach out to us. So even though I do my best to make sure they know how to access their version of the therapist list, I still get calls. Linda, how do I get this list? Well, I made it very easy for you, but in case you forgot, here it is again.
Yes.
But at least they know who to call, and I think that's really important. And it's just because we've talked about it, our bishops talked about it, and we're out there always talking about it. And then I just also wanted to point to an organization that I found to be very helpful in finding therapists in our area, and that's the Catholic Psychotherapy Association. It's a professional organization for clinicians who are Catholic, and whether they identify that in their practice or they just happen to be, and they also happen to be a therapist. So that's been a really great organization. They provide professional development for mental health clinicians. And I know it's not out yet, but I know that they are also working on a code of ethics as a part of their organization. So that I see as providing us as the church with some language that fits in the clinical world in terms of how we can talk about various topics around mental health in a way that we know is Catholic and also professional, because that's something as a non-professional I struggle with a little bit. So that's coming along. I know they're working on it and going through the process of adopting a code of ethics. So again, very resourceful, not only for clinicians, but for those of us in ministry who are trying to connect the dots and know what we're talking about, but also know who to talk to when we need something to provide better support and services for our families. So I just wanted to point that out as well as a really helpful resource.
Yeah, great. Yes. It's just a matter of knowing where to look and linking. You guys have named so many different resources that you've turned to. And I love the idea too, that where you're saying like, this didn't work perfectly the first time, and we just tried this and that worked, this part worked, but this part didn't. And you just keep going, right? Wonderful. Okay. So I know we have some questions. I'm going to open them up, and maybe Jen, have you kind of combed through them? Yeah.
Yes, definitely. Thank you, everybody, for what you've shared so far. Very quickly, Tracy, one of our attendees, asks, who facilitates the prayer circle?
Oops, sorry. Members of our ministry team. And then we invite a deacon or a priest to come and do a little reflection each time. And then we have volunteer musicians from our music ministry that come
All right.
So,
Thank you, Tracy. And then perhaps, Linda, you just spoke to this when you talked about the Catholic Psychotherapy Association developing a code of ethics. One of our questions says, what is the legality of specific recommendations to therapists and not crossing the line between spiritual guidance and being part of the care team? So do you feel that that code of ethics is hoping to address that, Linda?
I'm not sure if the code of ethics will address that per se, because at least for the clinicians who are members of the Catholic Psychotherapy Association, they're licensed professionals. They are they happen to be Catholic, or they want to provide services in that from that perspective and values and things like that. But I would say for priests or ministry leaders who are making referrals off our list, we make it very clear that we are not professionals. I mean, that's a very big part of mental health ministry, right? We make it very clear that we are not professionals. We're not part of your health care team in like that hospital or healthcare setting sense. We're here to support you as fellow Christians, as people who care. And so likewise with our priests making those referrals, it's not that they are specifying that this family that must go to this particular clinician. They're just providing some information in the hopes that they'll find who they need. So that's why, as part of our guidelines, we always recommend that clergy or ministry leaders provide at least 2, 3, or 4 names, because it's really up to the family to decide who they want to receive their health care from. And the spiritual guidance, obviously, we can provide, but it's in the spirit of being helpful, not providing health care.
Yeah.
Yes, thank you, Linda. And then Marjorie, perhaps you can answer one of our other questions. Has anyone developed a logic model on how to address mental health questions? This would be a single page to guide someone responding to an individual who's looking for guidance.
I honestly, no, but I know that that our association is trying to create a model, and Jen has been working very hard on it for mental health ministers, the types of questions that they commonly have for getting started. Honestly, I was reading that question to answer the one that Linda was talking about, because I was thinking of, I wear the hat of being a mental health minister, which is very different from when I wear the hat of being a psychologist, which is also different. I don't know, there's other hats, but I thought that this question was asking about crossing that line. I think when I'm a mental health minister, I'm really clear that I am not being a psychologist. Very, very clear, because there's certain things that I do as a psychologist that I don't have the capability of as a mental health minister. And it's good that I have those limits as a minister. So I think that's what I was responding to. But I like this idea of the logic model. And Jim, if you send me, I see that Jim McDowell is the one with the question. If you send me an email with the kinds of questions you think would need to be on there, I think it'd be lovely to try to create one. That being said, I think it's good to stay in our lane as mental health ministers, and just say, we're here to pray with you. We're here to support you, to share our journey with you, and to help you get resources. Yeah.
All right. Anyone else have a response to the question about a logic model? To my knowledge, I have not yet seen something like that.
I haven't seen anything like that. I will say one thing that I found really helpful that I've shared is one of our hospitals, one of our Catholic hospitals happens to be, has just like a 1-page flyer that explains the different mental health professional roles and how they're different from each other. So like a psychiatrist versus a psychologist versus a marriage and family therapist. Because I think a lot of people don't actually know the difference. So for example, they'll call our office and say, I need a psychiatrist. But actually they don't. They just need to see a marriage and family therapist or a social worker. They don't need to have meds. But because people don't know what's out there and what each role does, they're almost asking the wrong questions sometimes. So for that kind of education piece, I found that to be helpful and something that is needed. People don't even know where to start, or people don't even know what they're asking for. So this is a little different from the logic model question, but I think any of that kind of information that we're able to provide helps people find what they need in a timely manner, because they're understanding what they're asking for.
Thank you, Linda. That is helpful. And so here's something that, as many of you have spoken, this has kind of come up, a list of secondary resources. And so I think it's a question of how much can one ministry do? What are our capabilities for providing resources? So, for example, a recent call to this person's parish was from a person who had several difficulties. Turns out that in the end, this woman needed legal help for a special situation. So this ministry was able to put her in touch with a free legal clinic at the diocese, which helped her immensely. But as a mental health ministry, legal help resources wouldn't normally be found on a mental health ministry resource list. So I guess just speak to, can we be all things to all people, or how do we help people with food insecurity, with housing insecurity, with some of the other pieces that may come along with mental health ministry?
So I can jump in here and just say couple of things. So firstly, I think it's helpful to also be in partnership and dialogue with your fellow offices here at the diocese. So Office of Life, Justice and Peace, Hispanic Ministries, Youth Ministry, and kind of be working in tandem together. So everyone's kind of aware of the different good things that are out there and things that are coming up, so that as those calls come in, even if you don't have the answer, you might have a colleague who might have a kind of a good trail for how to access something that you maybe don't have. I think there's enough, oftentimes, we reference the OC Navigator, which is kind of like a database of, you literally can input specifically what you're looking for, whether it be mental health related or social related or financial related, and it pulls up kind of geographically the resources in your area. So I think going through kind of a centralized resource through the county or through the state, being able to at least offer something like that, which I think is comparable kind of across different states and counties, to offer something similar to that, I think can be very helpful. And then I would also say, some of our, with the intersectionality, right, of all of these different issues, a lot of our healthcare partners in our healthcare systems are recognizing the need for kind of having a multidisciplinary wraparound approach. So I know we have one hospital just in particular, Hogue, which is not Catholic, it's Presbyterian, but faith-based very much in their mission and vision. And they have a community center that they are constantly sending us kind of free clinics or free legal aid and free diaper giveaway, things of that nature, to be able to share with people who are calling in and share those resources with our parishes. And so really this idea that health, mental health, physical health, it's all integral to kind of these other issues that connect to your well-being as a human being. And so being able to have partnerships with our healthcare systems as well in the community are often, I'm finding, a very key resource for being able to tap into some of those other pieces, as well as sometimes, even if I just don't know when a question comes in, I can email, one of our contacts at these healthcare systems who deal with community outreach. And usually I get, bless their heart, an answer by the end of the day, and I can circle back with that person who's asked. So again, I think the multidisciplinary approach and the holistic care is something we're kind of moving to a bit more. And so I think there's more out there, and just being in tandem and in partnership with those contacts, I think, is really critical.
Perfect. Thank you, Rebecca. That's and somebody else has added to the Q&A that partnering is really one of the best ways for us to have whatever resource or help someone to find whatever resource they may be seeking. So we're getting,
Also,
oops, sorry, Tracy.
I was going to add one little piece with the implementation of 988 across the country, that in a lot of areas, there are specific providers that are signed up to be the call recipients for 988. And I know in our area, our mental health center, they have a whole boatload of resources because they are going to be the person that's answering those 988 calls, as well as our township. They have social workers who are really connected with local resources, and sometimes that's helpful.
Yeah, that's such a great resource that we didn't talk about. Yeah, the national mental health number now that you can call 988 since last July. So yeah, great.
All right.
It's just like 911, but just
Okay.
for mental health.
We only have a few more minutes. So Marjorie, if you would answer the question about why are a couple people wearing a green ribbon, and then we'll have one last question after that.
Oh, it's Mental Health Awareness Month. May is Mental Health Awareness Month. And so both Rebecca and I have these ribbons on that we got from our partners at the county. They provided them because they're not cheap to get them all, and then plus to put the pins in them to give them out. So that's why we're wearing them, just so that we can have that, let other people see that we like to talk about mental health.
Awesome.
Mhm.
Thank you. And then the very last question that we'll take today is, how often do you get non-Catholic people approaching for support to deal with their mental health or illness? And how do you help them or redirect them to the Christian therapists if asked?
I have a quick answer. We don't get it that often, but the one way that we do, and I think it's a great way to evangelize, is when you do have a partnership with NAMI and you can provide those support groups or those classes at your parish. They're very scripted. They're literally scripted. The classes, they read from a script, but I know that some of our mental health ministers will say, I'll be here 15 minutes ahead or 15 minutes late to pray with you if you want to pray, because they're just drawing people in from the larger community. So I think that's one way. And I don't think it happens that often. But I get calls from people all the time because they know I talk about mental health, and who are Catholic, not Catholic, whatever. So I don't necessarily steer them to a Christian therapist unless they ask. But
All right, wonderful. So with that, we'll just do a little bit of a wrap up, which is number one, thank you to you four women for all this valuable information you've shared with us. We're so appreciative. And thanking everyone who joined us today as part of our audience and for the great questions that you submitted. We appreciate that. I did put in the Q&A at one point a link to a feedback form to help us serve you better through future webinars. So if you are able to click that link and fill that in after the webinar ends, we would appreciate that help. And then lastly, we hope that you'll mark your calendars for next month's webinar, which will be on June 27th. That'll be at 10:30 Pacific and 1:30 Eastern. Dr. Chris Miller will be talking with us about mental health ministry models and supports with young people, so those who are 18 and under. We hope that will be an enlightening webinar on mental health ministry and youth. And Dr. Miller is going to help us unpack mental health ministry efforts with young people, including best practices around suicide, programming options, and special considerations such as mandated reporting. He expects that webinar attendees will leave that learning opportunity with several mental health tools and supports to be used to effectively minister to and with young people. So please watch for your opportunity to register for that webinar soon. There should be a link on our association webinar resources page by the end of today or tomorrow for next month's webinar, and through emails and social media posts over the month to come. And of course, we will be posting the recording from today's webinar, as well as all of the resources that we've discussed on that same webinar resources webpage. So with that, I thank all of you again so much for presenting today, for all of you for joining today. and wish everybody a blessed June. All right, thank you.
Thank you.
So